我哋夠鐘，亦都夠人啦。
Good morning. It's time to get started. We have already formed a quorum. Now let's invite the officials and the deputations to come into the conference room. Good morning, members. Thank you for coming so early in the morning.
今日咧就我講一講個會議啦，就有30。
Today we have 35 deputations. This is a public hearing. After they've spoken, the members can ask questions. This meeting will last until 12 noon. Among the deputations, number 14 and number 15 would like to speak ahead of the schedule order because they have other business to attend to. So is that agreeable? If members do not object, I'll let them speak first. Please also invite the deputations to come in. Good morning. Wait, 有冇份嘢俾我讀啊？冇喎。
係請大家按照自己嘅座位
Please take your seat. At our meeting on the 11th of July, we resolved to invite deputations to offer views on the bills, on the private healthcare facilities bill, and then the Secretariat posted a notice to invite deputations, and we also sent the same notice to the 18 district councils, and 35 deputations are here, and also another 6 organizations have submitted views, but they will not be attending this meeting. May I remind individuals and deputations attending this meeting, your speeches are not covered by the Electoral Powers and Privileges Ordinance, Cap 382, and your views are also not under the coverage of the same ordinance, that is Electoral Powers and Privileges Ordinance. Every deputation will be given 3 minutes to speak. May I remind deputations that if you want to give us your written submission, please hand a copy to our staff, and then we would distribute your submission to members of the Bills Committee. Before the meeting, we have accepted a request from 2 deputations to speak out of order. I have sought views from members of the Bills Committee, and if they have no adverse comments about that, so I will invite number 14 and number 15 to speak first. So the first one is Dr. Leung Yun Sun. Professor Raymond Leung Hin Sun. Thank you, Chairman. I'm from a steering committee on ambulatory care facilities and standards. I support this bill. My committee has been looking into the relevant issues for some years already. I think what triggered this is that in the past, we had hospitals and we had clinics, and in the middle we have some daycare, surgeries, ambulatory services facilities. And it seems to us that we cannot rely on laws for hospitals to regulate operations carried out in such day facilities. So depending on the complexities of the operation, the physical conditions of the patient, whether anesthesia is required, we have to decide what operation should be carried out in such daycare surgeries facilities or operations facilities instead of clinics. And we need to have proper rules and regulations to regulate such activities and operations. Of course, there's a wealth of experience in overseas jurisdictions. We cannot copy them all wholesome. We cannot copy all of their practices because Hong Kong is a crowded place and our clinics are not equipped in the same way. So we need to consider all these issues, and we also have to consider the other problems such as fire safety and occupational safety. In this context, we have to bear in mind the autonomy of the professionals, because technology is advancing very quickly. Some operations might have to be carried out in a hospital, but now it can be done in a clinic and so on. So we need to keep in mind that we have to move ahead with times. And we believe that is important, that we have a relevant body to oversee the regulation. And I believe the proposal in the schedule of the bill, that is the Hong Kong Academy of Medicine be entrusted to do this, is in our view appropriate. Dr. Yong Chiu Fat, I represent Hong Kong Doctors Union. We have hospitals, we have clinics, and we have also got convalescence facilities, and they are subject to proper regulations, but not some newly established health management organizations. So my union fully support the government's proposal to regulate such healthcare facilities in order that public interest is properly safeguarded. Apart from more regulating such commercially run healthcare facilities, we are also in favor of granting exemption to the clinics solely operated and managed by doctors, because doctors are already regulated by the Hong Kong Medical Council. So perhaps the government can come up with some self-regulatory system for doctors' clinics, so that small clinics operation will not be affected by the long arm of the government, so to speak. But we've got some reservations about the bill as well. For example, a small clinic is defined as one having fewer than 5 doctors or dentists. Nowadays, in order to save costs, we have clinics shared by up to 8 doctors. So we need to look into the scope allowed for small clinics.
A registered medical practitioner is not allowed to take absence for more than 60 days in a calendar year, while many doctors or practitioners would like to take or further their studies or refresher courses, and they might need to take courses maybe twice a week, and that would take up 100 days. So why do you have to limit the operations of a small practice clinic Because our doctors might not necessarily want to become partners, and I think that you're trying to limit the freedom of small practice clinics this way. Thirdly, it states also that the operator of an exempted clinic must give the director not less than 14 days notice in any intended change of cessation. And if there is a doctor is penalized, then maybe the day of notice is 28 days. So I think that the government should try to make this consistent. Thank you. Now we invite Madam Ma. Thank you. I represent medical beauty management. So well, would those working in beauty medicine also be limited under this bill? And that is actually very worrying for our industry. We are afraid that the beauty technology would also be limited under this bill. Medical procedures and beauty procedures are actually two different industries. It's entirely different. So we request that the machinery and technology used in these two industries should be separated so that there would be high quality and safe beauty services for the consumers. In recent years, there have been many medical issues in private healthcare facilities leading to deaths and injuries. High-risk procedures, I understand, should be regulated to ensure the safety of the consumers. Thank you. Ms. Jill, please. Thank you. I also represent the beauty industry. Enhancing the quality and safety would improve private healthcare facilities. But now there is a very vague line between the beauty industry and medical industry. And this has affected the operations of the beauty industry. So we have the following suggestions. Clause 12, it said that that on procedures affecting the lives of consumers, 15 beauty services have been put under the medical regulations. The government has always seen or regarded consumers as patients, and those enjoying beauty services are not actually patients. We are afraid that our patients, the term of patients is very vague, and it seems that the government also regards beauty services as medical procedures, and that is a very high limitation on the beauty industry, and that would actually impact consumers on picking the best beauty services for them. The beauty industry uses many natural remedies to try to prevent aging, and we should not be regulated under healthcare facilities. So we sincerely request that the government set up a long-term regulation and direction for the beauty industry. If, according to the government, then we would need to adhere to Clause 66 and 67 to recruit the services of a medical practitioner. The operator would also need to work under Clause 19. Well, if our understanding is correct, that means this private healthcare facilities bill is closely related to the beauty industry, yet there are not clear regulations. Therefore, we worry that the industry would not be clear about all the regulations, and after the bill comes into effect, the industry would be impacted, and we would all be regulated under this bill. Therefore, I hope that the government will inform us clearly. And we also hope that the government would set up as soon as possible a steering committee on the operation of beauty industry, so that beauty industry can also become more professional to ensure the safety of all the consumers. Thank you. Next, Mr. Leung Ji-dat. Thank you. I represent Haven of Hope Sister Annie's Girl Holistic Care Center. Basically, we support the bill, but as in the letter that I sent on September 30th, there are 2 points that I would like to express concern and would like to request the government to fully consider it before enacting the bill. First is the transitional arrangement. The SASHCC currently provides 100 beds, and we provide palliative care services to patients. In the past 10 years, we have provided services to over 2,000 patients, from young to the old, those who need palliative care services, so that they could also have a choice other than public hospitals. Under the new regulatory regime, right now we are using CAP 165, but under the new regulatory regime, we hope to become a hospital for chronic diseases. Therefore, we do need more time for transitional arrangements in order for us to satisfy the new regulations. Therefore, we hope to request that the Department of Health give us more time to prepare for the CAP 459 requirements. As we provide palliative care services, many patients refuse emergency services or resuscitation services. So, under the Code of Practice for Resuscitation, there is a regulation that there would be an on-site medical practitioner 24 hours a day, but for facilities and care centers such as ours, we only need a doctor to be on call, because most request not to be resuscitated. So I hope that the government will deal with this in a flexible manner. Thank you. Next, we have Professor Leung Ka-kit. Thank you. I represent the medical HKAM. We are fully in support of the new regulations. I would like to touch on 3 points today. First of all, we believe that we should ensure the safety and the rights of the patients in our discussions. So how do we ensure this? Well, there must be a standard that does not affect the professional autonomy of the doctor. As long as the doctor is able to adhere to the safety standard, then the practitioner can make his own decision. Secondly, how can we formulate the standards? So this, of course, goes back to what I've been talking about, professional autonomy. And of course, legislative councillors and public can discuss this under the legal framework, but for professional standards, as Dr. Leung said, the doctors should be able to make their own professional judgments. We do have doctors from different professions, And regardless of whether doctors are working in private or in public, they should have their own professional autonomous decisions. Of course, we welcome suggestions from others, but we should mostly listen to professional suggestions. And thirdly, during the transitional period, we have to ensure that there is ample time for the industry to provide training and to ensure that there will be both sufficient hardware and software. The HKAM suggests setting up a series of standards. If people from the industry would like to participate in the training courses to ensure that they would be able to comply with the regulations, will be able to provide such training. And so this is my view. Thank you. Ms. Shalini Matani.
My name is Shalini Matani. I represent patients. Although I'm from Hong Kong, I will prefer to speak in English for this. So I operate a social enterprise called Hospital Advisor, which has engaged with close to 1,000 patients over the last 9 months. I would like to start by saying that this legislation is much needed. We have been waiting since 1936 for reform, which is shocking. And my comments are based around two main concepts of one, patient-centered care in Hong Kong, and two, greater transparency. I have sent in my comments already to the Bills Committee, and I have 14 comments, which I will quickly share now. But in light of what some of my predecessing members have already said, I have added a 15th. So the first one is around Clause 55(2)(b), the responsibilities of the Chief Medical Executive. We believe that the Chief Medical Executive must keep and maintain employment and agency contracts of all medical practitioners of hospitals. All my comments, should I say, are about hospitals in Hong Kong. And the reason is many private hospitals, as you already know, do not keep employment contracts between them and the practicing doctor. And so in the case of a patient, if there is an issue, we are left in the lurch about what is the relationship between the doctor and that hospital. So there needs to be very clear contracts between doctor and hospital. The second one, my second comment is around Medical Advisory Committee. The names of Medical Advisory Committee members must be publicly available on the healthcare facilities websites. Again, it is critical for patients to know who is in charge, who are making decisions in that hospital around medicine. Thirdly, Clause 58. The function of the MAC, we would like to add that the MAC must also be fully responsible and aware of all medical and legal cases of medical complaints. Right now, it is very clear that in a lot of hospitals, often the board and the MAC is unclear about what are the outstanding legal cases. Clause number 4, 60B. Over here, it says that the director must ask the MAC for information. This would imply that the director knows something and then has to ask the hospital. Actually, the director is a pretty important guy, a woman or man, and may not know of all things that are happening in all hospitals. Therefore, we're asking for the licensee to provide information to the director on a timely basis. You can decide the timing. Number 5, Clause 64, 3A, B, and C. You talk about the licensee, upon receipt of a complaint, must investigate, must make improvements, and must inform the complainant of the findings. We would like to know for each of those A, B, and C, what is the time period of each of those. So does the investigation have to be within 12 months, okay. 18 months?
Okay. Sorry, Ms.
I will be quick.
Malini. Yeah. Because you have a submission and all members received that.
Okay.
So I think the time is up now.
Okay.
Sorry.
So I would just like to say one more
Okay.
thing that has been raised by a couple of my colleagues, which is around safety standards. I think safety standards have already been very clearly defined by WHO, specifically around surgery, and there is no need for us to redefine those. Thank you.
Thank you. 林永芳醫生。
Dr. Lim Wing Fong. Thank you. I'm Lim Wing Fong. My comments are on privately operated day procedure centers. I want to talk about the core standards. My center is a private specialist day procedure centers. We have done 50,000 procedures so far. We have been in operation for quite some time already, and like other private facilities, of course, we set up our systems in accordance with professional standards and international practices. And so they are quite similar to what is provided in the bill. Although that means that the running cost is on the high side, but that would also mean that the safety level is high. It goes to show that the standards required under the bill would be manageable and feasible. I think the bills only talk about basic requirements of day procedures. With new management style, new procedures, new technologies coming up, all such healthcare facilities should also update their practices. If we have a healthy private sector healthcare facilities, then it will go a long way to shorten the long waiting time of public hospitals. So that's the beauty of having a dual system in Hong Kong. And we're also in favor of establishing a complaint handling mechanism. But sometimes complaints handling has a negative connotation because one only makes a complaint after there's an incident. So I would like to suggest that the government should monitor the performance of different healthcare facilities, different day procedure centers, such as by reference to some performance indicators. This will also enhance competition among the private healthcare facilities. And that would also go a long way to improving the image of our medical healthcare services as a whole. Dr. Ho Chung-ping. I represent an organization on nephrology. I would like to offer quality service on nephrology in Hong Kong. And I want to in particular talk about the renal dialysis service center, which has been in operation in Hong Kong for more than 30 years with a very good performance. We have 500 patients, and the cost for the patient is much lower. All in all, we are in favor of the bill before you. First of all, I want to talk about whether hemodialysis is a risky procedure. In 2014-2015, during the consultation phase of the document, we submitted that hemodialysis should not be considered as a high-risk procedure because so many patients, stable patients, are already doing this in their home. And it can be done, for example, with the assistance of the spouse of the patient. we agree that safety is important. In the past, this is regulated under Cap 165. But since such private hemodialysis centers are small in scale, they should not be regulated like hospitals. In the past, we have to renew our license every year, and every time we have to fill in documents with more than 100 pages. Sometimes we have to ask a doctor or a registered nurse to handle with all these. But since the procedure is, in our view, not very risky, we believe that an EN, enrolled nurse, can be allowed to operate the procedure. Anyway, we are in favor of the new bill because regulating such centers like they are hospitals is already an outdated mode. We hope that when you come up with regulations, you will involve private hemodialysis centers. Dr. Feng Ho Wang. Yes, my name is Feng Ho Wang. I represent Beauty Procedure Doctors Association. I represent a group of doctors doing the beauty services. There's no such specialty in the Hong Kong Academy of Medicine. We have more than 200 members. We have discussed the bill, the amount of cells, and we have decided to support the bill, including the regulation of private beauty services facilities, because this is going to help safeguarding the public interest. And what I'm going to say from now on is my personal view, because the members do not come to a consensus on this point. I am in favor of asking doctors to take out insurance coverage for their professional service in this regard. Mr. Ho Wang. Very often we have medical incidents in private hospitals, and the patients have nowhere to turn to have their complaints handled. And we have had a number of serious medical incidents in the HA. So many people are worried about this situation. According to Cap 165, Cap 343, they have very narrow scopes. They were enacted in the 1960s. They are quite insufficient in managing modern-day service delivery. So the government should amend the laws to bring them up to date. But it should bear in mind the impact on beauty service. Under the bill, different beauty centers, depending on the procedure to be carried out there, have to apply for different licenses and subject to different levels of regulation. But now the medical equipment is equated in many ways as beauty equipment, but it's not the same. Going to a hospital for a medical procedure is not the same as receiving beauty service in a beauty center. The government should not go for management convenience and at one brush classify all the beauty service equipment as if it's medical equipment. And the government should also find ways to reduce the costs of private healthcare procedures. The government should consider buying beds from private hospitals to cater for the need. The government has the money to do it, For example, just like what the government did during the last flu season. And this will also enhance the capacity of private healthcare facilities. Second, the complaint mechanism should be improved. The bill proposes a two-tier mechanism. There will be an independent committee to deal with complaints. But I found out that the compensation will be such that half of the members will be from the medical professionals. But there's no one from the beauty industry. Why not? Because they are also stakeholders. Dr. Lam Chi-yun. I'm from the Hong Kong Medical Association. We have discussed the bill for quite some time, and I don't need to repeat points already made. I just want to convey some worries of doctors because of licensing problems. You know, in the past, some restaurants had to wait for 9 months to get a license, and they would not be able to survive without a license for that long. So many clinics are small in scale, and they cannot afford to wait for a long time for a license to be issued. If a clinic is qualified to be exempted, why not just give them a license right away? And you can inspect all these clinics and if you want, and doctors are anyway subject to the regulation of the Hong Kong Medical Council. And there are endoscopic centers, hemodialysis centers, and other day procedure centers which are subject to regulations of different standards. I understand that this is the result of your discussion, the government's discussion with the Hong Kong Academy of Medicine. So in many ways, we are copying administrative measures from overseas jurisdictions. So this is not, strictly speaking, evidence-based. A number of years ago, some patients were referred to private practitioners because of the long waiting list to have cataract operations, and many private practitioners were able to upgrade their facilities significantly because of the high volume of operations. But has the government looked into the performance levels of private practitioners? Do we have to copy measures and practices from other jurisdictions all the time? I think government should look at the actual data, the empirical evidence from local clinics. But all in all, I have to say that my association is not against this bill. On the question of buying services from the private practitioners. Last time, they buy service from private practitioners, and very quickly the problem is solved. Mr. Lee Wei Chun.
I see that this bill is mainly to regulate private healthcare facilities, and we see that there are some places where we need to make sure that there are clear definitions. For example, in providing diagnosis or procedures facilities under one of the clauses. does the diagnosis have anything to do with the laboratories? I think it needs to be clearly defined. And you can also see that in 165, it talks about health services establishment. And in C, there are 2 points pointing out. One is assessing, maintaining, or improving the health of patient. Now, these are a bit abstract, and the other is diagnosing or treating illnesses with the term or. So we also provide diagnostic tests in our laboratories. And our lab technicians in 359A, we also have regulations for the lab technicians. Therefore, we want to point out that in our understanding, the diagnostic term here is actually a diagnosis given by a medical practitioner, which is not exactly the same as a diagnosis given by a lab technician. So we hope that there will be clear definitions. So the laboratory technologists in Hong Kong only have this one point we would like to raise regarding this bill. Thank you. Dr. Zhou, please. Thank you. Well, we look into this. We are allied professionals, and we have under our association lab technicians, radiologists, optometrists, etc. We have waited for this bill for a very long time. We heard many other individuals talk about medical services. Actually, aside from doctors, there are still many people in the allied professionals in the health sector. In recent years, we have seen a lack of professionals in our sector, in the allied health professional sector, especially in the private healthcare facilities, because many do not see a way forward in development. We hope that our sector would also see a way forward in the private sector. We are in support of this bill. We know there have been many discussions made for this bill, and we hope that once the bill is enacted, the government will be able to provide enough resources to the Department of Health to execute the bill. Because when we talk about private healthcare facilities, we're talking over thousands of such facilities. Does the Department of Health really have sufficient resources to support the bill? We don't want the bill to become a toothless tiger after it is enacted. Thank you. Mr. Yun Hoi Man, thank you. I represent a Democratic Party. We are in full support of the bill because this bill can really ensure and safeguard the rights of consumers. But we do have a couple of suggestions we would like to present. First of all, there are some people who really like to use the term medical in their advertisements, and we need to make sure that some non-accredited organizations to use the term medical in their name so that it could better safeguard the interests of the public. And there should also be higher transparency. I see that there are some exorbitant fees are charged by certain medical practitioners, but with the enaction of the bill, I see that the government will work towards collecting data on professional fees charged, so that the public will be able to make a better decision regarding the services. We see that many private facilities do not provide transparency in charges. We hope that the Department of Health would work towards improving this. And we understand a committee will be working on that. And we should not exclude or omit patient organizations as members of a medical committee, because only by including them would we be able to improve services. And another point I'd like to raise is a complaint mechanism. I understand there is such a mechanism, but no time limit, or maybe a very short time period within a period of 2 years or so. But when there are medical issues, sometimes we believe that 2 years is really not enough. A longer period should be offered so that the patients could protect their rights. I see that there are some exemption arrangements, but I hope that the exemptions would not be too lax. Otherwise, there would be loopholes in which some areas would not be regulated. So I hope that the government will fully plug all the loopholes. Thank you. Mr. Ip Sai Hong, please. Thank you. Good morning. Enacting the private healthcare facilities bill to better protect the interests of the public, of course, has the full support of us. But if you look into the background of this, it is not as described in the government brief that we should work with the times. In 2010, there was actually, they decided to set up a committee on medical issues because of the DR issue. And the former director, Dr. York Chow, set up a steering committee, and so at that time the steering committee also set up a working group to try to set clear lines between the beauty industry and the medical industry. But the representative of the beauty industry was not treated in a friendly manner, and therefore the committee dispersed. Well, should beauty services also be included under Cap 161 of the ordinance? Actually, if you look at it is said that some procedures should be done by medical practitioners. But is it really a medical procedure as stated under Cap 161? The working group did not further discuss whether the 36 small procedures would be considered as medical procedures. At that time, Dr. Cole decided to seek expert advice, but then after that discussion, it tried to regulate medical facility and regulate equipment instead of the services. And so for the past 4 years, nothing has been done, no more discussions have been made, and the beauty industry is afraid that some of the procedures or services provided by the beauty sector would one day become medical procedures. So even if we're talking about aesthetic medicine, should the beauty industry also have their say in this matter? I hope that the government would tell us whether there would still be definitions made between medical services and beauty services. And I hope we really follow up on this matter and not come up with some new regulations all of a sudden. because the beauty services are not looking into opening day procedure centers or anything like. We hope that we would have our own development. Thank you. Madam Choi, thank you. I am an advisor to the Beauty Association in Hong Kong. The beauty industry provides services using new technology. The private industry has been very professional in ensuring and safeguarding the interest of the public. Private healthcare facilities bill in its paper stated that high-risk beauty procedures would also be seen as high-risk medical procedures. And beauty equipment may only be used in hospitals, day procedure centers, or private health care facilities, etc. If this is really such a case, then the 6,000 beauty salons in Hong Kong will be forced to close down or limit operations under the enaction of the Private Healthcare Facilities Bill. I want to ask the government how you are going to place all these beauty technicians who would lose their jobs. The beauty industry is still able to maintain a very good performance in Hong Kong, and we ask the government and legislative councillors to set up a bill for the beauty industry so that there would be clear definitions on the regulations of beauty services. We also ask for an individual discussion platform for our profession so that consumers will also be able to make a more informed choice in our services. We are not asking for individual interest of certain beauty salons. We're asking for it because we want to safeguard the public interest. Thank you. Next, we have Professor Lau. Thank you. We are in support of the bill. And we want to ensure that there will be clinical standards adhered. How can we really balance risk and cost? That is something we are concerned with in the Hong Kong Professionals and Senior Executives Association. And we also have a different understanding of the regulations of all the medical procedures. And it's very hard to request all the same standards. Therefore, we hope that the government will consult the different professionals. And also, in setting up professional standards, we hope that it would become consistent. At the same time, we also suggest that there be ample time in the transitional period so that the private healthcare facilities would have sufficient time to prepare for the change. there is a clause stating that there should be a medical director to look into the management. We do have reservations about that because we believe that half of the board of directors should be registered doctors to ensure that the facilities will be able to comply with the professional standards of doctors, and that would enhance the entire profession.
We support the bill. We hope the government would allow sufficient manpower to enforce the new regime to ensure and upgrade safety and standards of healthcare. And it's hoped that the bill will also promote the growth of private healthcare centers so that it can fully complement the public system. Dr. Lee Kai-yu. I am the chairman of the Hong Kong Private Hospitals Association. On behalf of my association, I would like to express our support to the private healthcare facilities bill. We hope this can be enacted at an early date. I think this bill can address the needs and aspirations of Hong Kong people. They want to get quality healthcare services with ease of mind, and they will not be cheated by the substandard practitioners. Our association represents altogether 12 private hospitals. We believe that whatever the regulations system is about, patients' interests should come first. We think that day procedure centers, while not regulated like hospitals, should be subject to the same level of supervision and monitoring, and they should be required to have comparable medical equipment as other hospitals. Private hospitals are inspected and supervised by the Department of Health. It's hoped that with the passage of this bill, the Department of Health will be empowered to the sufficient degree to monitor the work of private hospitals and such healthcare facilities covered by the bill. And there should be a proper system on regulation as well as the reporting of incidents. Private hospitals provide healthcare services, but also aftercare, as well as public health monitoring surveillance. But daycares, day procedure centers may not have acute services or facilities, and personnel may also not be properly trained in emergency medicine. Dr. Veronica Y. I represent a group called Association of Private Medical Specialists of Hong Kong. We work in different private medical facilities, and all our members are specialists. I believe our views should be taken into account in the consideration of this bill. We are in support of the bill, but we think that two issues are omitted here. I hope officials would pay attention to the two omissions. First, healthcare facilities should be classified in accordance with risk. If the patient suffers from a serious condition or the procedure can result in injury or death, such procedures should be carried out in hospitals. Low risk or medium risk procedures can be carried out in day procedure centers or clinics. For low risk procedures, they can be carried out by airline professionals in licensed healthcare facilities. The last round of legislative amendments was carried out in the 1960s. So more than 60 years have passed, and we need to update the law. And the schedule of the bill should carry clear classification guidance, and such information should also be turned into subsidiary legislation, which can be amended and updated regularly without amending the principal legislation. According to the bill, there is a complaint handling mechanism. I have to stress that sometimes the service providers and the patients may have different expectations of what the procedures can achieve. So we believe, apart from complaint handling, we should have a mediation mechanism for the disputes, so that we don't have to rely on the courts and the Hong Kong Medical Council for all sorts of disputes. Mr. Yip Man Ban from DAB. Recently, we have had a number of serious medical incidents. We in the DAB are very concerned about patients' rights, the handling of complaints, and the regulation on the part of the government. So we welcome the new bill, which will regulate private healthcare facilities, and instead of relying on two outdated ordinances. We welcome the introduction of an investigation procedure. We welcome the establishment of an independent complaint system for patients. The DAB would also like to see the enhancement of transparency on charges and administration of healthcare facilities. We welcome the new requirement that charges and should be made available to patients in a transparent and easy to understand manner. We hope that the new system can be enhanced by providing more details. And we would like to remind the government to pay attention to the other licensing requirements for healthcare facilities, such as building safety and fire safety. Professor Wu Chi-yun, I'm from the Chinese University of Hong Kong. We support the bill because it can enhance the safeguards for patients in the light of the modern mode of delivery of healthcare services. CUHK provides also provides some medical services through our facilities, and our services are provided for the purpose of teaching in the Faculty of Medicine and research as well. And therefore, these services are provided on a non-profit basis. But still, we ask for some charges be made by the patient in order to recover costs. We manage the system strictly in accordance with the rules promulgated by the UGC and the government. And we submit that such healthcare facilities under the faculty are different from private healthcare facilities, and therefore we would like to seek an exemption under the bill. Mr. Dennis Fulgrave.
Thank you. Dennis Fulgrave. I'm representing the Li Ka-shing Faculty of Medicine from the University of Hong Kong. Firstly, we support the introduction of this improved regulatory regime. Like Chinese U, the Faculty of Medicine currently operates and is planning to further establish a number of medical service facilities for the purpose of teaching and research that provide medical services to patients. Under the existing medical clinics ordinance, these facilities managed and controlled by Hong Kong U are excluded from the scope of the regulatory regime. This exclusion is not continued in the current bill. Hong Kong U is a public university incorporated in a public body under the University of Hong Kong Ordinance with well-established public sector accountability measures. It is noted that several other bodies, corporates, for example, the Prince Philip Dental Hospital, is excluded as a specified authority, and hence such facilities managed or controlled by them are excluded from the definition of the Private Healthcare Facility Bill. Such an exclusion should equally be applicable to such facilities managed or controlled by Hong Kong U. We would therefore respectfully request consideration of an exclusion from the regulatory regime proposed by the bill, perhaps under the clinics, day procedure centres and health service establishment categories for such facilities managed or controlled by Hong Kong U for the purposes of teaching and research. Thank you.
Thank you. 請汪國成教授，唔該。
Professor Wong Kwok Sing. Good morning, Chairman and members. I want to make 3 points on this bill. First, the definition of clinics. With an aging population and more patients suffering from chronic diseases, it's a consensus in the medical and the healthcare facilities that we should provide more clinic-based services. We have a very successful experience in reducing the number of patients which are served and treated by allied professionals, and cut the number of hospitalization cases. Apart from clinics, there are other healthcare facilities in the community providing necessary services such as palliative services. If there's a need to appoint a chief medical executive, well, the cost is going to be much higher. Many doctors are not interested in administrative work, so the requirement of a chief medical executive would mean that some of these facilities will not be able to operate anymore. And also for the composition of the relevant supervisory bodies, you should consider including nurses and other professionals.
Mr. Chen Wei-kit, I'd like to look at the complaints mechanism from the perspective of a patient. Actually, this complaints mechanism or this committee, half of them are professionals, half of them are non-professionals. But 50-50, you see that there is always exactly half. So I suggest that doctors or dentists or medical professionals should only take up one third of the composition, and then the 2/3 of them should be made up of other professionals such as lawyers and such, and then also maybe legislative counselors and or maybe district counselors. So that there will be a large enough pool to be more fair in the mechanism. Only by then would this mechanism really be just and fair. Secondly, the first tier of complaint, I think that you should also look into new composition, as I've just mentioned, which is 1/3, 1/3, and 1/3. And members should actually, be randomly picked each time so that it will not constitute of the same members for each complaint. Well, if it's only for the first instance of complaint, if the first instance complaint committee decides that it is groundless to continue, the patient should also have another chance to appeal. We want to protect the interest of the patients. We hope that patients do not have to go directly to higher court and then go to the medical council, and then it takes 8 years, 10 years, and still, the case continues. This is not in the benefit of anyone at all. And I hope that when you declare interest, there should be a interest declaration, so that professionals would not just seek their friends to be other members. We want the whole process to be fair and just. And we hope there should also be a service pledge so that the cases do not drag on forever. The cases drag on for so long. Thank you. Thank you. Mr. Hu Jiawei. Thank you, Chairman. We believe that when there are medical incidents, it would affect the patient mentally, physically, and emotionally. Therefore, we see in the private healthcare facilities bill that there's actually the suspension of the doctor's license. But if the medical facility continues to operate, we see that for hospitals you would penalize 5 million, but for day procedure centers you're only 1 million. But as a medical facility, you only talk about 100,000. If you look at this different proportion, then there is not a huge deterrent for the medical healthcare centers. So I think that I believe there should be a larger penalty for these centers. And then when there is a suspension, these facilities possess a huge number of patient data. I don't see any provisions on what to do with the data or how to preserve the privacy of the data with the suspension of a facility. Thirdly, there would be many arguments on fees. We hope that there would be higher transparency in fees so that patients would be clear on all the fees so that they do not have to go to the Consumer Council every time. Thank you. Mr. Pang Hong Chang, please. Thank you, Chairman. We have sent out a written comment, but I'm sorry we sent it out late on Friday, so maybe you might need some time to read through it. So I'll just like to highlight a few points. On the drafting of the bill, we actually support the inaction of the bill because we do have to keep up with times. And this bill will help consumers make informed decisions in regards to beauty services or medical procedures, so that they would fully understand the risks before they take up any such services. And we are also in agreement with regulating private healthcare facilities, so we are in support of the bill. On certain clauses, on 32 and 34 on the penalty, it talks about the licensee of a private healthcare facility and a licensee of a non-healthcare facility. There's a different penalties, and another and someone already just mentioned it, that it is unfair that there should be so big a difference, that we believe there should be a stronger deterrence for all facilities. And for patient data, sometimes patients are not able to retrieve their data even when they request a change of facilities. We hope that hospitals would also set up channels for the patients to look into the transparency of the fees and services. As for 64 and 65 regarding complaints, there's a mention of complaints mechanism, but there is no clause on the time period. We hope that there would be a clear time period on the services, and that there should be a service pledge. There should be a response within a few months. There's a mention of the complainant, but for some people who prefer to remain anonymous, and maybe the complainant may not be the complainant himself, we hope that there would be some provisions to help complainants. And there's also no mention on how to deal with some kinds of high-risk procedures. Thank you. Mr. Wong Siu Kang. Thank you, Chairman. Good morning, members. I would like to say that Society for the Promotion of Hospice Care has been in Hong Kong for 30 years. We're a non-profit organization, and we provide and services in terms of hospice care and palliative care. We hope the government or legislative councillors will consider some of the fine points for resuscitation of palliative care patients. Sometimes there may be arguments on how to work on that, because under the WHO, when we define palliative care, we want to help those patients to die a dignified death and to enjoy their last moments of life. But we have to deal with this very carefully, because in Hong Kong, there are not many people who work in the sector of palliative care. We lack professionals in this area. People's awareness of palliative care is very low in Hong Kong. And emergent and resuscitation arrangements made for these patients are difficult without having 24-hour doctor on board in these facilities. In Hong Kong, we have we have around 365 palliative care beds, and our society has around provides about 10% of this, which is around 30 beds. And we need to pay a $42,600 license fee for this service. I hope that the government will try to provide more resources for us. Thank you. Next, we have Madam Tam So. I represent the Consumer Council. Basically, we support the private healthcare facilities bill to preserve the interest of the public. We have 5 suggestions on the regulation on medical procedures, complaint mechanism, exemptions, and fees. On medical procedures, we suggest that there should be regulations on the development of services. Many people have said today that under the definition of beauty services, we know that some procedures would need to be undertaken by medical practitioners, and some of them need to be done by medical professionals. So for high-risk procedures, they should be done in a regulated facility, so that consumers will understand that they need to go to these facilities for high-risk procedures. We understand that in terms of violation, there are penalties for the facilities. We hope that the bill would also empower the director to send out warning to the facilities that are in violation of the bill at an early stage. Under the current draft, complaints can be made within 2 years, but we believe that the time period should be extended. If you look at the Australia as reference, the time period is 5 years. So when consumers lodge their complaint, maybe at the Consumer Council level, then some time would have been wasted. So we suggest that the time period be extended to more than 2 years. Some facilities are privately owned, and for small practice clinics, then they are constituted of 5 of 5 practitioners or less. I believe that when we give exemptions, we need to be fair to all. Thank you. Thank you. Dr. Chen Zhenguang. Thank you. Chairman, I'm Jane Chan. We have 9,000 people in our association. We have doctors, dentists, nurses, technicians, etc. We have consulted many of our members, and we have not received any objection to this bill. We ask during this transitional period that there should be flexible enforcement so that it would not affect the operations of small practice clinics. Now I would like to talk about my personal view. Professor Leung Ka-kit from HAAM said that patients' safety and interests should be safeguarded. Therefore, when the government looks into enacting this bill, we welcome this. We hope that you would complete with the procedures as soon as possible and to ensure that there be professional autonomy in our industry. Thank you. Next, Dr. Liu Wai-ming. Thank you, Chairman. I'm the chair of the Hong Kong Dental Association. I'd like to thank you for the invitation to attend today's meeting. We are supportive of tightening the regulatory mechanism of private healthcare facilities to safeguard public health. We hope that we could have representative to attend other consultations organized by the government so that when you set up the code of conduct, we could also give our views from a perspective of the Dental Association. Thank you. Professor Chong Wai-yi. Thank you, Chairman. I would like to talk about palliative care and hospice care. In principle, I personally support the bill, but I find that there is no clear definition on palliative care and hospice care and which type of services it is under this bill.
Hospice care is provided to terminally ill patients, cancer patients, and patients suffering from other organ failures. We all know that in the recent hospital authorities strategy, a lot of importance has been attached to hospice care because of the aging population, and the demand is expected to grow very rapidly. Apart from HA, hospice care is provided by other organizations such as Bradley, Haven of Hope, and others. So as I've said, the service demand is growing, and we expect more service provider will be added to the current list. We are providing care and services like hospitals in terms of medical standards, healthcare standards, infection control, and so on and so forth. But there are special features for hospice care. For example, the patient can give advance instructions on whether resuscitation should be carried out, and some patients may also go for home care, at the final phase. So I hope members can understand the special features of hospice care and decide what kind of regulation system should be appropriate for such service units. Good morning. My association has a history of 37 years already. Our members are beauty parlors, beauty service groups, and aesthetic medicine is a developing sector. We hope that the beauty service sector will be subject to reasonable regulation, and that consumers' confidence can be maintained. We have been talking to our fellow practitioners, like those who have spoken, and we share their views. If we are required to hire a medical practitioner to monitor some of the procedures, then when the medical practitioner is on leave or is on sick leave, the appointments already made will have to be cancelled. And moreover, we have thousands of such beauty service units, and how many doctors are really willing to take up work in those units? Dr. Lee Kim Man. I'm from the Dental Council. We are responsible for the registration and regulation of dentist practices. We also conduct disciplinary hearing for complaints against dentists. We are in support of this bill because the objective of the bill is in line with the Council's mission to promote public health. Under the bill, some dentist clinics will be regulated in accordance with the new bill. Some 70% of dentists work as private practitioners. They provide dental service to patients. They carry out small operations in their clinics. And the dentists, of course, very concerned about the new regulation on facilities and equipment. We have, in recent years, been bombarded by a lot of advertisement put up by non-local dentists. And I believe regulation under this new bill would enhance public confidence in dental practice. We hope there will be more clear guidelines for local dentists. I hope that local dentists will be regulated on the same footing. Thank you. I thank all the deputations and individuals who have spoken. Now I will invite the officials from the Food and Health Bureau to provide a response. Mr. Chris Sun. Good morning, Chairman. I thank the 30-odd deputations for coming to this meeting and offer their valuable views on this private healthcare facilities bill. Before this bill was tabled, we spent quite a lot of time on charting the direction to go for the bill, and there was a free a consultation exercise for 3 months, and in the light of the feedback, we have make a lot of changes to the draft bill. And in fact, we have seen many of the deputations here, and we have also met doctors and dentists and other people a number of times to discuss the implications of this bill. But there are still some new perspectives offered in the deputations submissions, so we'll look into those after the meeting. For professional bodies and associations for dentists and doctors, most of them will be concerned about the details in the regulatory system. I have to say that the proposed regulation is, first of all, for the purpose of safeguarding patients' interests, but we also respect professional autonomy. We have already set up a steering committee to set up standards for private healthcare facilities, including day procedure centers. It's really a mammoth task. The committee has started to work on this in 2015. We understand that there will be the need to talk to the professional bodies to come up with a set of standards, which, while in keeping with the principle of professional autonomy, will safeguard patients' rights and interests. We have a exemption proposed for small-scale clinics. There are two views expressed today. Some would like to see some relaxation, and some would say that we have to proceed with caution so that we will not overdo it. In the consultation phase before this bill, views were equally diverse. We have to carefully balance the views from different sides in the scope of exemption. We like to go for a solution which is biased, which is not biased, and of course, in the scrutiny of the bill, we would be open to suggestions from members of the Bills Committee. CUHK and Hong Kong U have made some similar suggestions. We will carefully consider their views, because under the two universities, the faculties of medicine, they have some healthcare facilities, and they have got some clinical services which are set up for teaching and research, and they would like to seek an exemption. We have an open mind about that. If members find this agreeable and reasonable, we are willing to offer it in view of the high standards of the two universities. And also we have received views from deputations from the beauty service industry. But this bill, I must say, is based on the premise involved. And this bill is not about regulating equipment. For example, if it's radiological equipment, is regulated by another law. But this bill is about the premises used by dentists and doctors. So we are concerned about whether some service is about healthcare services, whether it's for aesthetic or other beauty purposes, is not a point to consider. We are concerned about the premises, the healthcare facilities, which should be operated up to the requisite professional standards. I understand different sectors may have their worries, and that would take further explanation to be offered. I would say that this bill will not affect the normal operation of beauty centers. This bill only stipulates that if some premises are run as defined in the bill, they will need to be licensed.
And there are three deputations today representing palliative care and hospice care. And actually, we have talked to Haven of Hope Center and also to Society for the Promotion of Hospice Care on the transitional arrangements. We have tried to alleviate their concerns. Therefore, we have come up with quite a good transitional arrangement. But as to whether they would like to seek a license under this bill, we are going to continue our discussions with them. Because with the aging population, we do also want to look into improving our service as well. We're talking about four major services here: hospitals, daytime procedure centers, and also medical procedure centers. And so we also have can look into one more area. With the changing of times, we are flexible enough to deal with all the different situations. Perhaps I could stop here, Chairman, for now. Thank you, Mr. Sun. Maybe you can also give us a written response to some of the areas in which you haven't given any reply in. Well, now we have the opportunity for our members to ask questions to the administration or to our deputations. So may we start with the first member, Dr. Helena Wong, 5 minutes each. Thank you. Chairman, I have a question on palliative care and hospice care. Well, so Mr. Sun, you haven't really elaborated on the fourth category. Well, you said there's room for change in the future, but you've already, put up this bill for discussion. We already have, organizations looking into palliative care. Of course, there would be future development, but which category or which area are you really putting these services in right now? You talked about non-profit hospice care services, and you charged them 42,000 plus for a license, and not too many organizations can afford this license. So what is your policy on palliative care? Do you want them to provide such services, or do you want to hinder the services? You really need to let us know what your positioning is. We see some deputations here today concerned with the regulation on beauty services. Well, you told us that it's not going to affect operations of beauty industry. Well, for those that do not or are not in relation to medical procedures, there is no such regulation yet, but there is a gray area in which certain beauty services provide medical procedures. So is there a need to have a medical practitioner on site for the, for those centers that offer procedural services? Mr. Sun, please. Thank you. Thank you, Dr. Wong, for your question. First, in relation to palliative care, My understanding is that some are seeking licenses under homes for elderly or under CAP 165. In the future, we understand that some organizations may want to operate as a hospital or as a healthcare facility, and they may seek a license, and they may need some time to consider this. So we do have a transitional arrangement. After this bill comes into effect, they do not need to apply for a license immediately. They can operate under their current model. So this is our understanding. Some organizations want to continue like this, but if some want to operate under CAP 459, this is also possible. So that is what I mean by flexibility. They have different choices. We do not have many such organizations providing palliative care, so we try to discuss with them individually on what or how they would like to proceed on the way forward. For the license fee, perhaps I could defer this question to Dr. Jiu. You are right, Dr. Wong. For regular beauty services that do not involve equipment or procedures, of course, they are not under regulation. But if it is a medical procedure, I think it is clear that you will need a professional to execute it. Our bill allows, let me say, a beauty center to become a healthcare facility as long as they comply with the requirements of the bill, including having a medical practitioner to be present. So I would like to once again reiterate that we are concerned with the interests of consumers, that anything that involves medical procedures should be done under this bill. Dr. Chiu, please. Thank you. Society for the Promotion of Hospice Care operates much like a private hospital right now under CAP 165. We have discussed it with Dr. Leung on the way forward. Currently, in Schedule 9, there is a schedule on nursing home. So for the transitional arrangement, they can actually operate much like the current model to be regulated by the Department of Health. But if under the new bill it wants to become or registered as a hospital, then it would need to apply for another license. As the Society for the Promotion of Hospice Care, they would need to pay at least 42,000 for the first license. But for renewal of license, then we wouldn't charge 42,000 each time. Under Schedule 3, Clause 12, it said that if it is a hospital, we're talking about a renewal of license fee for around $5,000 per every 2 years. Then it would be up to whether the organization wants to become a hospital or not. The greatest concern we hear from them right now is if they are a nursing home or operating in providing palliative care, they operate much similar to hospitals. But the problem is whether there needs to be an on-site doctor to comply with the bill, and what to do if there is no need for resuscitation services. So we would follow up with the society later on. Thank you. Dr. Ann Chang. Thank you, Chairman. I'm a bit concerned with the future of many private healthcare facilities. Although you said it would be under regulation, you would see that there are many interests, such as interests of the board of directors, interests of stakeholders, interests of licensors, etc. And it seems that most of the responsibilities are to be shouldered by the medical director. Would you consider, as I think some deputation mentioned, purchasing insurance for the medical director of a facility, because most of the responsibilities are on the director? Because in future, if there are any complaints, where should the complaints be lodged against? The hospital or the director? So I think you need to try to look into this from the perspective of patients. We've looked into nursing homes. I think none of us feel happy about the news we read yesterday about an elderly passing away. We do lack resources in homes for the elderly and nursing homes. I hope that there would be more policies from the side of the government to take care of elderly people, and not to try to limit their development with expensive license fees. These fees are a huge burden on small NGOs. We have also always been concerned with beauty services. There are about tens of thousands of people working in this industry, and recently there have been some incidents in which equipment has been used, leading to deaths and injuries. But we're only talking about individual cases, and there are only a couple of individual cases. If you regulate these too strictly, it might affect some small and medium-sized beauty salons or beauty centers. They might not be able to survive, and these are mainly job opportunities for women. The beauty sector has approached me before asking the possibility of setting up of a certain of something under the Department of Health. Some of them have already bought equipment. But I think you should still try to talk to them, because this is a huge industry in Hong Kong. So I sincerely request the government try to help the beauty industry as well. Mr. Sun, thank you, Dr. Chiang. We are going to go back and look into the matter of a medical director on whether they need insurance or not. Dr. Jiu said that a small number of nursing homes may want to apply to become hospitals under this bill in the future. And under this bill, a new hospital will need to pay a license fee. For the regular nursing homes for the elderly, they do not pay this fee because they are under another regulation, not this bill. What we are talking about is an elderly home that wants to change or transform into a hospital. Then they would need to pay the fee. And it is only the first registration that charges such a high fee. We understand that there are many concerns on the beauty sector, but I would like to emphasize that today we are only talking about the bill on facilities. I think we are clear on the definition of facilities. We're talking about the facilities used by medical practitioners, such as doctors and dentists. We understand that the industry is concerned with equipment, but equipment is not under the private healthcare facilities bill. So be rest assured, we are not discussing equipment here. We're talking about facilities here on doctors and dentists working in the facilities. So I just want to make this clear. But we understand your concern. We hope there would be more communication in the future to try to alleviate your concerns about equipment later on. Dr. K.K. Kwok. Thank you, Chairman. I'd like to thank all the deputations and individuals for coming to share your views today. I'm not going to repeat what has been previously said. I just want to ask Mr. Soon again, the beauty sector.
超過13年。
The matter has been with this council for some 13 years now. You want to regulate the facilities, the procedures, the practice. In the first year of the last government, the government said something had to be done, but 5 years now, nothing has been done, and now it seems that we're in a stalemate. Yes, the beauty service industry has contributed to our economy, but we have also seen incidents of unqualified practitioners so perhaps the government should tell us the plan, the direction forward. Are we going to drag our feet for another 10 years? Are we expecting to see some progress? And also, this bill does not regulate HMOs. In other jurisdictions where they have HMOs, they are subject to regulations. Is it that the government is afraid of these powerful HMOs? And recently, some insurance companies are also taking up this role. They are also offering HMO services. Now the line is drawn at 5 medical practitioners. But HMOs can have a lot of service units. Each one of them will have just 4 doctors, and they will not be regulated. For hospice care, I think there should be a separate category for hospice care, palliative care. Dr. Chiu said the first license would cost more than $400,000. For years, you have shifted the burden to these hospice care units. So now you have the audacity to ask them to pay you $400,000. This would be this would deal a deadly blow to the hospice care units. There should be a separate category for these hospice care units. Of course, we need to treat voluntary service units differently from for-profit organizations. So perhaps you should respond to their concerns as soon as you can. Mr. Sun, regarding medical equipment, as I've said, it's a separate issue. This bill is about facilities or the premises. And I have to say that regulation of medical equipment is outside my portfolio, so I cannot really give you the so-called definitive answer here. In the last legislative session, we tabled a paper here on how we can take a step forward. So this bill is about medical healthcare facilities, and so let's stick to the healthcare facilities or healthcare premises. And Dr. Kwok talks about HMOs. Yes, we are concerned about the development of HMOs in Hong Kong, but as a matter of statutory definition, it's difficult to come up with a precise definition. One of the concerns of the public is that the investor of such HMOs or operators who are not doctors, they may be concerned about other things such as profit, but they do employ doctors to deliver the service. The board of these HMOs and the doctors under their employment may not see eye to eye on all issues. And also the concern is whether the patient's interests will always come first. Under this bill, it's clearly stipulated that if the investor is not a doctor, and even if just one doctor is employed, then the license has to be, the clinic has to be licensed. But over the years, we have seen doctors running a clinic as a group. So the decision is made by the participating doctors. So that's why we provide an exemption for such a small scale clinics run by doctors themselves. So unlike an HMO where the investor may not be a doctor. So under this bill, if a clinic is invested by a non-doctor, and even if just one doctor is hired to do the job, the clinic has to be licensed. This is the result of a very long discussion, and we have come down to this line of drawing it at 5 doctors. So for these clinics run by doctors, they are not like investors who may have other motives or objectives. But of course, the number, the line to draw is something that we can discuss. Some hospice care units are run as nursing homes. This can continue to be the case, but some hospice care units may like to be licensed as hospitals, but every unit is unique. We bear in mind the special characteristics of palliative and hospice care. Of course, under the bill, there is a charge for the first hospital license to be granted if they so wish to transform into a hospital. Mr. Siu Ka-fai, we have some deputations from this beauty service industry. most healthcare professionals and their organizations are in support of the bill, but more concerns and misgivings have been expressed by the beauty service deputations. Although Mr. Sun has said that this is not really directed at the beauty service sector. So I would like to ask the two deputations from the beauty service industry to say something more about their concerns. We understand this bill regulates the facilities, the premises, but as I've said, Clause 12 prohibits any procedure that may lead to personal injury. And it said that if a non-medical professional carries out any treatment leading to injury, and if it's a medical procedure that we're talking about, that person commits an offense. We have been providing the aesthetic or beauty service, but since 2013, the government unjustifiably designates some of the beauty procedure as treatment or healthcare procedure, and some of our equipment is now designated medical equipment. So we are deemed to be carrying out some treatment procedure, although we are just providing beauty service. So if our treatment and procedure is carried out in such a way that personal injury is caused, we breach the law. So under Clause 12, our premises also regulated in that we are carrying out such a procedure under the bill outside a clinic, or according to the Clause 60, 67, and 90, if a beauty center hires a medical practitioner for some of our procedures, do we need to have provide an independent or enclosed premises for those procedures to be carried out by doctors? And if there's something untoward in those procedures, would the licensee be held responsible? We're very unclear about the scope of regulation. We'd like the Food and Health Bureau to provide clear guidance to us. There will be a need for the government to clarify things to our industry before the law comes into effect. Mr. Yip Sai-hung, I understand this bill is about regulating the certain premises, but what procedures have to be carried out on those premises? So it's going to impact us. You have been saying that we don't have to be worried about this, but you have not been able to tell us how to make a distinction between different things. Well, that's why Dr. Cohen-Mann, the previous secretary, set up a committee, a steering committee, on how to distinguish different procedures and different equipment. If it's that easy to tell things apart, there would be no need for the steering committee to be set up, and there would be no disagreement among members in that steering committee, and they have quarrels. I understand members would like to see patients properly safeguarded and that we have proper service standards. It's only that the government has refused to talk to us. In the last legislative session, the government, this council proposed the setting up of a steering committee. There's a joint motion passed by two panels of this council. the two-panel chairman wrote to the CE to set up a committee to consider regulation of the beauty industry. It was said that the industry was doing well, and the qualification of the practitioners could be regulated under the qualification framework. Yes, this bill, on the face of it, is about regulation of premises and equipment, but you would impact on our service provision. But you have refused to regulate the beauty service industry, so that we can provide quality service to consumers. But the government is not willing to do it. We have no intention to transgress into the healthcare sector. We are not trying to poach patients from doctors.
I'm sorry, I'd like to allow some time for the administration to respond. We understand your concern. Mr. Sun, please. Thank you, Chairman. Perhaps I would defer to Dr. Chiu on clause 12, and then I will supplement. Thank you. Dr. Chiu, all right. Number 12, we're talking about is there is any medical procedure and it's not done by doctors, dentists, or other medical professionals, and causing to injuries, then that would be in violation of clause 12. Well, let's say if you go for a facial, then the consumer would not necessarily be injured, and so you would not fall under clause 12. But if you undertake high-risk procedures, then you might violate clause 12. And so in 343 and 161. And for registered doctors, there are also similar clauses. If you are not a medical professional, yet you cause personal injury to others, then you might be violation of the law. So this is actually the principle under clause 12. Just now an example was given, natural remedy. Well, naturally, there are many natural remedies in Hong Kong right now. This is a new bill, but there are also existing bill that regulates such remedies, and so it's pretty much similar. It's really dependent on what you are doing. If it's a low-risk procedure that does not cause personal injury to others, then there would not be a high possibility of violating clause 12. But if you undertake high-risk procedures that would cause personal injury, then you would violate clause 12. Thank you. Mr. Sun, please. I want to point out that in 2012, we discussed the difference between beauty sector and the medical profession. I think we did discuss on whether there is any intervention or invasive treatment, such as injecting certain things into the body. If there is some kind of injection, then you know it's clear that it should be done by a doctor. But when we discussed equipment, there was a huge argument. And I understand the concern from the beauty sector. So I would once again emphasize that this is on the bill of healthcare facilities. Equipment is a separate matter for discussion. Well, you may have other views regarding this point. Mr. Shukafe, you're very concerned this matter as well. Maybe you can discuss with the industry to see whether there could be follow-up actions taken. Mr. Shukachen, please. Thank you, Chairman. I also want to follow up on this. Yesterday at this time, I attended a seminar on elderly care, and we discussed the provision of grassroots healthcare provisions. And just now, one of the professors also talked about this. I'm concerned with whether a registered nurse clinic would also be a violation of the bill. Because we do have many centers operated by registered nurses right now to try to alleviate the burden on hospitals and clinics. In your mental health review and in the grassroots medical health care, it talked about the cooperation between doctors and nurses, and social workers would also be invited to handle mild cases of dementia in the elderly. So I want to ask how you can ensure that the social workers in elderly homes or those clinics operated by nurses would not become a problem or find it difficult to operate under this bill. Thank you for your question. We drafted this bill very carefully. We don't want it to be too broad to affect those that should not fall under the bill. But I would like to invite Mr. Lee to supplement. Perhaps he can elaborate on this matter. Thank you, Chairman. Thank you, Mr. Xiu, for your question. Also, what do we mean by premises under the bill? We're talking about medical organizations. So we were very careful in defining the term premises. On hospitals, daytime procedure centers, and then for HSE, the fourth category, it is actually a larger category. That even though there is no dentist or a doctor, if there is a need for regulation, then the Director of Health can also announce the inclusion of this category. So for clinics operated by nurses or optometrists, the premises right now are not included under the private healthcare facilities bill. We are concerned that it would be unclear because we said that premises would need to apply for licenses. So in clause 92, we also mentioned the use of titles or descriptions. Let's say hospitals or clinics that do not apply for a license cannot use the term clinic or hospital to mislead the public. Mr. Xiu, any follow-up? No. All right. Dr. Chen, Dr. Pierre Chen. Thank you. Many of the deputations support the bill. Well, this is what I heard. But most of them hope that it would not include a certain sector. Well, I would like to ask about the term premises to the administration. So what is the definition of premises? Let's say I have an organization or a hospital organization. I work in the new territories. My headquarters lie in new territories, but I have a branch in Kowloon or on Hong Kong Island. So what is the definition of premise then? Is it a part of a property, or how would you define the term premise? Is as if physically or not? Thank you. Well, this is a very good question, Dr. Chen. For the term premise, it could be a physical property. Let's say, because we're talking about, let's say, a hospital that is using a hospital license. Even if you open a branch, you can operate with the same license. But in future, for premises oriented license, let's say you have a headquarters in your new territories, yet you open a branch in Kowloon, then it would be 2 premises and you will need to apply for 2 licenses. Because many people are concerned with a large number of premises operated by an organization. You have to ensure that each premise would have a medical director or medical practitioner in charge. We understand the uniqueness of Hong Kong because we have multi-story buildings. Well, let's say you're renting the 3rd floor and the 8th floor in a certain building, and it uses the same elevator. So can it be counted as 1 premise? That may be so, but perhaps I could ask Dr. Chiu to tell you about the uniqueness of this in Hong Kong. Thank you. So, if we look at Clause 8, there's also interpretation of premises in relation to private healthcare facility. So, a premises, as we said, it should be physically attached or in close proximity. And that is also a function as a single entity. Let's say it's a private hospital. A private hospital may operate different satellite facilities in different locations in Hong Kong, and 1 license currently covers all the facilities. But in future, the hospital facility would apply for 1 license. But if a satellite facility, a satellite clinic is on an outlying island then that premise would need to apply for a separate license. Mr. Soon also talked about instances in which a clinic operates a few units in the same building. So that would be able to work a single license because the facility would function as a single entity, and would also give our suggestions and recommendations when they apply for licenses. All right, thank you. So when I browse on the web for beauty industry, I see that there is a pop-up for a Facebook page on some of the actually a list of blacklisted beauty centers. Well, I understand that there should be a differentiation between beauty centers and medical facilities, but there are some names that they use different expressions. For example, they use the term aesthetic medicine. Let's say they use the name aesthetic medicine, yet they say they do not provide any medical procedure. And let's say in Clause 12, they said they caused personal injury to others, yet they say that they did not use a medical procedure. So how would the government deal with that under Clause 12? Dr. Chiu, please. Well, I would let her explain. Of course, there are some limitations in the expression used. If you did not apply for a license and certain expressions would not be in use. We would limit the use of certain expressions because it is listed in clause 92, the prohibited use of titles or descriptions that do not apply for a license. That is under Part 7, Clause 92. They should not use titles or descriptions that includes the expression misleading consumers. Dr. Chiu, perhaps you can explain Clause 12 as well. Thank you, Chairman. There are two concerns here. One is the name of title or description, which is under Clause 92. And on the medical behavior, which is under Clause 12, the medical behavior we're talking about is not only exclusive to this bill.
Under the doctor's registration ordinance and dentist registration ordinance, if you do something which only a doctor or dentist is authorized to do, you break the law. So in such a case, if some medical procedure is carried out without the involvement or supervision of a doctor, then it's against the law. Ms. Alice Mack. Chairman, I quite a few questions. Let's see how much you can offer in response, or if you cannot do it today, perhaps a reply in writing will be needed. Well, you have a definition of a premises which would cover a vehicle. So if a medical van is covered, do we need a license for each and every mobile clinic on wheels? Second, the time limit for launching a complaint, which is 2 years. Why 2 years? Is it necessary to set a time limit at all? And if there's, you also draw the line at 5 doctors, some say it's too low, some would like to go for 10, but you would have offer too much leeway for HMOs. You mentioned the role of the investor. You provide the exemption so that it's more convenient for groups of doctors working together. But in a way, you also provide the same exemption to HMOs. But we don't want to have investors not shouldering any responsibility when there's an incident, while the doctors will be held responsible all the way. You have not been able to explain things clearly to the beauty industry. You are saying that they don't need to worry. The bill is not going to affect them. Perhaps you should elaborate clearly which provisions in the bill should not be their concern and which should be. First, definition of premises. You are correct. We're not talking about building premises. A vehicle, a car, is also part of the definition. We have mobile dental clinics, for example, on wheels, and they have to be licensed. And in the bill, that we set a time limit of 2 years for lodging a complaint against a private healthcare facility. We believe this is a reasonable time limit. Of course, we will listen to members and the public when we discuss the bill further, and we can make adjustments if necessary. We are going to provide exemption to small group clinics of not more than 5 doctors because we don't want to allow people to abuse this exemption. In such a clinic, all the 5 clinics must be the directors of the board, and there's no outsider. Let's say there's a board for the small practice clinic, and all 5 of them are directors of the board running the clinic, and yet they have one more director who is not a doctor, and then this exemption will not apply. We provide exemption for small group practice, small group clinics involving doctors and no one else, and no investor is involved. But if it's an HMO involving a non-doctor investor, well, such HMOs exist for some other reasons, and they will have to be licensed. Whether 5 is a good threshold or is something that we can further discuss. As for the communication with the beauty industry, well, we are more than willing to talk to them face to face or through members of this council. We try to allay their concerns to the best of our ability. We see how we can explain things better to them, so that they should not be worried unnecessarily. All right. Some the patients groups have talked about the complaint handling mechanism and and also the composition of the complaint committee should not have half of the members of doctors and half of them non-doctors. Would you consider going for something like 1/3 of doctors, 1/3 of non-doctor professionals, and 1/3 of other people? So yes, we have considered whether it should be split 3 ways: 1/3 of them doctors, 1/3 of them non-doctors, and 1/3 of them from other sectors. Actually, we don't have a major differences with patients groups as far as the principle of composition is concerned. We want to make sure that the Committee on Complaints should command public trust, public confidence. So we're saying that at least half of the members should not be registered doctors or registered dentists. They should be so-called lay members. But if members have other views, well, we're willing to justify our suggestion further, or we can consider whether there are better arrangements. But we need to have a sufficient degree of professional members. We need to have some sufficient number of doctors or dentists in the complaints handling procedure. If there are too few of them, then we'll be a bit concerned about the lack of professional input. That's why we suggest that we are not. The numbers are not set in stone. We're not specifying the numbers itself, but we're saying that at least half of them should be from outside the medical professions. Some of the deputations represent the beauty industry, and Mr. Sun has said that the government is willing to talk to you. I think we need to do this outside the meeting. We need to, for example, explain what is defined as medical procedures and what are just beauty procedures. And we need some members to assist us and in the communication between the government and the beauty industry. I'm a bit surprised by the high number of turnout from the beauty industry today. So we need to provide more assurance to them in due course. And Mr. Siu Ka-chun, second round. Well, the deputations from the beauty industry have some doubts, some questions, and I share those doubts. For example, in Clause 10, prohibition of any procedure that may lead to personal injury, and also under 1E, it talks about procedure leading to causing personal injury to the other person during the treatment or procedure. We now have laser treatment and also some tattoo surface, eyebrow tattoo surface. It's somewhat invasive. If they do this, can they do it outside of the 4 types of healthcare facilities? Because if it's done not in a healthcare facilities, it can lead to a fine of $200,000 or imprisonment for 3 years on conviction. Dr. Chiu would explain. Clause 12. You have to look at clause 1A and B. 1. Perform a medical treatment or medical procedure for another person who is or may be suffering from a disease, injury, or disability of mind or body. So it would be for the court, if there's such a case, if one is prosecuted, then it would require the court to rule whether that person is or may be suffering from a disease, injury, or disability of mind or body. So it's a patron of the beauty center, such a person. And secondly, you have to prove that the procedure has caused personal injury before you can secure a conviction under Clause 12. Well, may I clarify this? 12 bracket 1 bracket A talks about that someone who is suffering from a disease, and if you provide a service, then it's a treatment. And B, cause personal injury to the other person during the treatment or procedure. Should A and B be read together? Because A talks about someone's suffering from a disease. So if someone required a tattoo service for her eyebrow, then it's not a patient. Well, it depends on the person in question. Evidence is required. And also what is said to persuade the patron or the patient to receive such a treatment. But if it's not a tattoo service, it's something else, or if the person is led to believe that this is for the treatment of some disease. So Mr. Siu is correct. 12 bracket 1 bracket A and B should be read together. Let's say removal of moles for the purpose of aesthetic purposes, and also for the for storing the skin cancer, for example. Would that be regarded as medical procedure. Well, if you go to a dermatologist, the doctor will not suggest the operation right away, depending on whether the mole is going to is regarded as a cancer risk. If it's treated with laser, then there's no way the mole can be later examined for cancer symptoms. So it's very ambiguous, says Mr. Siu. Dr. Pierre Chen. There are university clinics and service units which may be caught by the bill. Some of the deputations have already said that they would like to be exempted, so I share the same concerns.
Mr. Sun said he would consider to take this out, and I want to hear more about from the administration. So what I hear is that the beauty industry said that they don't want to be regulated, that they should be taken out. But then if there is a doctor on board, then they would be regulated. It's just like education. Because if you said that there's a doctor, then you would be under regulation. But if there's no doctor, then you're not being regulated. Mr. Sun, well, let me try to answer your question, and then I will see whether Dr. Chiu has any supplement to make. We have to look at the design of the entire bill. The design of the bill is to hope that for a government HA and a PLA garrison would not be limited under the bill. We have also considered the two medical institutes under the two universities. The HA and the two universities have looked into what should be regulated and not. Well, actually, many centers or maybe people may have the misconception that some of the clinics or centers are operated by hospitals. So we have discussed this thoroughly with the two universities and have come to the knowledge that there are a small number of day procedure centers or clinical hospices that do not fall under the control and regulation of the HA, and they would need to apply for a license with this new bill. But our understanding is that that some work for research or medical research, such as the two universities, they are non-profit. The two universities have expressed their views, and we believe that, and if also councillors are also acceptable of this, that Chinese University of Hong Kong and the University of Hong Kong, those centers that are operated by them, if they work mainly for research and development, then we can consider leaving them out of the bill. We see in 343 on cap 343. I'm sorry, Mr. Sun. Thank you. Well, I think we need more information before we agree to it. I want more information on whether they are profitable or non-profit making. It has also come to my attention that some dentists help the grassroots, and there would be anesthesia procedures, and these would also fall under this bill. So I want to ask, well, if dentists are helping non-profit organizations in providing dental care, then they might accidentally fall in under this bill, in violation of the bill. Thank you. Dr. Liu, well, we have members who would provide volunteering dental services to the public. And we are very concerned with those with mental illnesses in recent years. We dentists would work together with doctors of general anesthesia to provide MAC services. Under the bill, not only look at the premises, you also have to consider whether the procedures are high risk. The MAC procedures are considered high risk treatments. So once the bill comes into effect, when the dentists want to work with the anesthesists to provide services for those in need, then they would be strongly limited, and they would not be able to provide these services to the public. Mr. Soon, thank you, Dr. Liu, for your question. In our consultation, there were a number of concerns raised by dentists. Let me try to rephrase this. Some dentists provide volunteering services, and they would hire a community center, then rent a community center, and then to provide dental services to grassroots patients. We excluded certain outreach services, but the example you just gave is would have to fall under the bill because it is a high-risk procedure. It is not something that can be done in clinic. It has to be done in a day procedure center. Well, we understand that you really want to help those in need. We understand you want to help the vulnerable. But then when we drew up the bill, we considered the risk. And MAC is a very high-risk procedure. And we did let the dentists know that they would not be able to provide such services in the future to the community this way. But we understand the good intentions, but it is just not possible under the bill. Well, okay, time is up. Dr. Chiu, can you be brief, please? Thank you. Well, we are concerned with this issue as well. So under the steering committee of the Day Procedure Center, there is a committee on dental services as well. Dentists, representatives, and doctors under the committee believe that anesthesia is high risk, and therefore it should be done under regulated procedure centers. All right, we only have 6 minutes left in our meeting, and Ms. Mack also has a second round of questions. So I'm sorry, Mr. Seal, we cannot entertain the third round of questions from you. All right, Ms. Mack, thank you. Well, so eyebrow brow tattoo would not be considered a medical procedure, right? I want to request Mr. Soon to really sit down to discuss all this with the beauty sector. Even though you did talk about definitions in clause 12, and you also said that the regulation of medical equipment does not fall under this bill, then according to the report given to us by the administration before the term ended last year, some beauty centers actually use medical equipment, and would those actually need to apply for a license? And would certain beauty centers that purchase a certain or individual equipment need to apply for such a license? I think you need to give very clear explanations to the beauty center, because we don't know how you're going to regulate it. We just want to make this clear to all the industries. We understand that the beauty industry is concerned with being regulated, because what they're doing is not providing medical treatment or procedures. They're actually helping people beautify themselves, so they don't think that they are providing medical services. I think that you really need to sit down with them and to explain to them. In the last few minutes, I would like to invite Mr. Pang Hong Chang to say a few words. Because Mr. Tamekit sent in a written view on the complaint mechanism, on asking for an appeal mechanism. Perhaps Mr. Pang can also respond on how the complaint mechanism can better safeguard the interests of the public. Oh yes, we did put it down in our written view. The complaint is not included under the bill. I think that when the bill comes into effect, then maybe the Department of Health would also send out a code of conduct or code of practice. I think there should be a service pledge, let's say, and when there is a complaint received, then the hospital should respond within 3 months, and maybe within 6 months for the complaint committee. We know that it might be difficult, but at least there should be a service pledge, and that there could be an extension maybe for special circumstances, so you can at least let the complainants know when they would be able to get a reply. When the complainant is not happy with the response by the complaint committee, and they think that the complaint is not substantiated, would there be other channels for the complainant to seek an appeal? I think there needs to be a further mechanism to allow the complainant to make a reasonable request for an appeal. Mr. Soon, please. Thank you. Well, of course, we would enhance communication. And what Mr. Pang said, we are also going to follow up in our future discussions. So would the government also talk to the patients' organizations on the complaint mechanism? Well, it's not only limited to the beauty sector and the patients' organizations. We, of course, are going to further discuss with all the organizations. All right, thank you. I'd like to thank all the individuals and deputations for attending our meeting. I hope that the administration will provide us with a written reply on some of the questions not yet answered. All right. Moving on to AOB, the next meeting will be on November 7th, 4:30 in the afternoon. Any other business? If not, meeting is now adjourned. Thank you.